Hello. The topic of the video is benign prostatic hyperplasia. Transurethral bipolar enucleation of the prostate. The prostate gland is one of the major organs of the male reproductive system. Its position is below the urinary bladder. Its secretion is mixed with sperm to become semen. Normal volume of the prostate gland is about the size of a chestnut and weighs about 20 grams. After 40-50 years of age, there will be different degrees of benign hyperplasia of the prostate, which affects the urination function of men. Lower urinary tract symptoms are very common, affecting about 40-50% of men over the age of 40. They include difficulty in urination, slow or intermittent urine flow, frequent urination, urgency, nocturia, pain during urination, and hematuria. In severe cases, may cause acute retention of urine. Symptoms of benign prostatic hyperplasia are similar to those of the prostate cancer, so the doctor's diagnosis is very important. Digital rectal examination, urine culture test, blood test, including renal function test, prostate-specific antigen (PSA), urinary flow rate, and prostate ultrasound scan help the doctor to make the correct diagnosis. Medical treatment includes alpha-adrenergic receptor antagonist, 5-alpha reductase inhibitors, or combination of these two drugs. Patient needs to discuss different medical options with the doctor. When bladder outlet obstruction due to benign prostatic hyperplasia becomes more and more serious, patient should consider surgery when drug therapy fails to control the symptoms or development of complications. He will also consider surgery when he cannot accept the side effects of the drug treatment. He needs to discuss different surgical options with the doctor. Transurethral bipolar enucleation of the prostate uses high-energy bipolar loop to perform the surgery. The entire procedure does not require an abdominal incision. A resectoscope is inserted into the urethra during the operation. Through the resectoscope, the doctor enucleates the benign prostate tissue from the prostate capsule. The enucleated tissue will be temporarily moved into the urinary bladder, and it will be furthermore collated and removed out of the body. Bipolar transurethral enucleation of the prostate is generally suitable for larger prostates. It has similar effects in improving uroflow and subjective symptoms as compared to traditional transurethral resection of the prostate, which has lower incontinence rate at early stage. The long-term recurrence rate of bipolar transurethral enucleation of the prostate is lower before the transurethral bipolar enucleation of the prostate. Some tests can include blood and urine tests, chest X-rays, and an electrocardiogram (ECG) to make sure everything is okay. Some medicines, including anticoagulants, may need to be stopped before the surgery. There are possible complications caused by general or spinal anesthesia. Please refer to the information booklet given by the Department of Anesthesiology. Patient also needs to know the possible surgery-related complications. They include damaging nearby organs, including urinary bladder or urethral injury, infection, wound bleeding, retrograde ejaculation, urethral stricture, erectile dysfunction, urinary incontinence, and death, which is a rare complication. Patient is recommended to have bed rest on the first day after the surgery. A urethral catheter is inserted into the urinary bladder. When the hematuria is improved, the urethral catheter can be removed. Self-limiting hematuria are common after the surgery. Patient needs to drink more water and take painkillers if feasible. Postoperative urination may be frequent and difficult to control. Patient needs to eat more high-fiber foods to prevent constipation. He can take short walk, but do not do strenuous exercise for at least 6 weeks. Avoid sexual intercourse for at least 4 to 6 weeks. He can continue all usual drugs, but needs to discuss with the doctor when to resume the anticoagulant. Depending on the job nature, patient can usually go back to work within a few weeks after the surgery. This video only provides basic information about the operation. Only common but not all possible risks or complications of the surgery has been presented. Patient needs to understand and accept all the possible complications before the surgery. For inquiries, please contact the doctor. Here's the end of the video presentation. Thanks for watching.